Okay, Mrs. Mancini, it's been 36 hours, so we're gonna discontinue your catheter now. So I'm gonna perform hand hygiene. Gather my non-sterile gloves. You don't need sterile gloves for this. Good. Are you still feeling any pain or discomfort? No? Okay. So to discontinue it, you want to check the charting first to see how much fluid was inserted, and there was 10 milliliters of fluid inserted into the balloon. So I'm gonna pull out 10 milliliters of the fluid from the balloon. As you can see, it'll just do that automatically. Right till 10, like so. Okay. Now what I'm gonna do is I'm gonna unhook this in the bag, and I'm gonna slowly pull out the catheter while coiling it with my hand and my finger. Like that. Put the catheter in there. Take off your gloves. And with just a paper towel and maybe a damp cloth, actually, you can just clean the perineal area side to side down to the middle, going from the top down to the bottom. And then you'd want to tell the patient to drink lots of water, encourage them to void. She did have an abdominal surgery, so educate her not to strain, but to still try to void on herself. Urinary retention after a catheter has been in is really common. The bladder kind of gets used to not voluntarily voiding, just constant outflow of urine, which is what the catheter does. So drink lots of water, encourage them to pee, and they might feel a burning sensation when they pee, but that is just because the Foley catheter was inside the urinary tract, and this would be causing the burning sensation. When they do need to void for the first time, just let us know so that we can be there to put a hat or a bedpan in, because we want to measure your urine output, and from there we'll take a bladder scan, see how much is still in your bladder to see how much urinary retention you have.